AMD is one of the leading causes of blindness in the Western world for those people of age 65 and over. And actually, when you get to 75, you've got a 30% chance of getting AMD. So it is something that people need to seriously consider and to understand the risk factors associated with it.
It's a disease of the retina. It's a disease of the macula. It's a disease of elderly patients, usually over the age of 55. And the retinal degeneration occurs at the level of the retinal pigment epithelium, Bruch's membrane. There are early stages which we know are markers of the disease, which we know predispose patients to developing more advanced stages of the disease. And perhaps most importantly, it's a bilateral disease. So we know patients who have disease in one eye are at risk of developing the same thing in the fellow eye, and particularly when they have advanced disease in one eye, then the fellow eye is significantly at risk within a fairly short period of time. Usually we're talking about 5 years here. Well, there are, of course, modifiable risk factors such as smoking, such as diet, such as cholesterol intake, blood pressure management, and there are non-modifiable risk factors, which predominantly mean your genetic makeup, your family history, which obviously you cannot do much about. So these are the important risk factors. And a lot of what's happening now in terms of prevention has been targeted towards understanding how dietary factors really impact the disease, and how perhaps modifying your diet or your dietary supplements could reduce the patient's risk of developing disease, which obviously is where where studies such as the AREDS study and AREDS 2 come into play.
What I've been learning about this evening is that actually it's a specific group that maybe need to think about nutritional supplements. So it's not everybody from the age of 20 that needs to think about eye supplements. Of course, we need a healthy diet, but we're targeting an older age group. So how do we help people understand what this thing called AMD is?
There's a common parlance used, a common phrase that's used, which is why wouldn't you take them? And eye health is such an important thing, and I think a lot of people take it for granted, but there's clearly it's a very emotive subject, and when people start having problems with their eyes, it becomes a big issue for them. So why not get in there early and manage it as early as you possibly can?
Just imagine seeing life like that, with a big black hole where you can't see what actually you and I are looking at now, because we're looking at each other and there's all that stuff going on over there, but it's not what we're really focusing on. But you blank out all of that and it's not nice. So that hit home. AMD is a difficult subject, I think.
So Preservision, fantastic product that has been proven in a large clinical study, in a landmark study in the US, conducted in over 3,500 people, and it's proven to reduce the risk of the progression of AMD by around 25%. In those people who don't have AMD, are at risk or are looking to maintain their general eye health, we have a product called Ocuvite Complete, which contains all the main constituent ingredients in the more latest evidence surrounding the management of AMD and the prevention of the contraction of AMD, if you like.
On a personal level, supplements are things that I've been interested in myself for quite a while. My own patients, for example, with eczema or dry skin conditions, I encourage to take high-strength fish oil supplements, and we now know, after years of certain doctors thinking that there is proof that it works, because there was a study in the BMJ this year that showed that. So we know that at the right strength, certain supplements help certain things. We know fish oils, for example, prevent arrhythmias. That's why Omacort, which is a drug, is prescribable. And this, I think, hearing it from experts and looking at data from studies backs that up, really. So I am comfortable with that